Well, actually, there is nothing I am aware of that can be done to stop mutations from happening, as the last time I checked, bacteria intend to keep replicating at a rapid pace with no intentions of stopping. Mutations in bacteria are always occurring either spontaneously or in response to some other factor. But that's not the only factor that influences rates and types of bacterial resistance. There are a number of factors believed to contribute to the emergence of antibiotic resistance. There are many potential factors, with some that appear to contribute to the emergence of resistant bacteria beyond what occurs spontaneously and through simple natural selection unrelated to any antibiotic exposure. Some authors point to the increased use of antibiotics or the use of antibiotics without adjuvant therapies, lack of patient adherence, or inappropriate use of antibiotics, which could include sporadic use during which proper levels of antibiotics are not maintained over time, are also thought to contribute. There is no single answer. However, exposure to an antibiotic does create an environment that often leads to selection pressure. On exposure, there is eradication of the very sensitive organisms, but also persistence of some of the less sensitive organisms. These less sensitive organisms then proceed through rounds of replication that create the emergence of some strains, referred to as mutants, that acquire greater mutational resistance, as these strains were not prevented by the initial eradication of their parent bacteria earlier on. Basically, the less sensitive strains that are persistent early on fall through the cracks, to later create bacterial strains that have achieved greater levels of resistance to antibiotics and may create more difficult clinical challenges. The reality is that resistance occurs when bacteria containing mutations that reduce their susceptibility to antimicrobial agents are selectively enhanced. The resistant strains of mutant bacteria typically require more input of energy, referred to as a higher fitness cost, than their susceptible bacteria counterparts. Overall, this competition for resources with the susceptible bacteria that expend less energy tends to keep the mutant strains of resistant bacteria in check. However, when an antibiotic is introduced, it kills or inhibits the growth of the susceptible, non-resistant bacteria, while resistant bacteria remain unaffected. This allows the resistant bacteria to proliferate and continually produce more mutant strains that are increasingly resistant to the antibiotic. Over time, this renders the treatment with the antibiotic to become ineffective because the resistant bacterial strains are now dominant. Yes, there is. Some of these strategies include reducing environmental contamination and limiting the unnecessary use of antimicrobial agents that engender bacterial resistance. An important strategy involves adjusting the dosing. It may be possible, especially with topical antibiotic therapy, that dosing can be adjusted to ensure that all susceptible bacterial cells are killed up front, or that the drug level remains at a concentration capable of preventing or restricting mutant growth. This raises the following questions. How much antibiotic is enough? Does it achieve any relevant systemic levels when applied topically? And is the antibiotic safe? Conventional wisdom suggests that the best approach to treating with antibiotics is to hit hard, or use enough by prescribing the highest recommended dose to treat the infection. This means dosing is to achieve antibiotic drug levels above the minimum inhibitory concentration, or MIC, until the infection is cleared. In many cases, dose-limiting toxicities are the main factor in determining a therapeutic dose. However, theoretically, a dose does exist that would inhibit the growth of all single-step resistant mutant bacteria. It just may not be achievable in practice due to the associated adverse events. In addition, if it involves an oral agent, the microbiological effects beyond the skin must be factored in, such as alteration of the gastrointestinal tract microbiome. Topical antibiotics may be particularly suited to a treatment approach aimed at impeding the emergence of resistance, provided the correct type of antibiotic is used. This is because some topically applied antibiotics have the potential to achieve levels beyond the mutant selection window, or MSW, without producing adverse effects.